filmed and recorded for live and subsequent broadcasts available through the Council website. The Integration Joint Board is a joint data controller within Inverclyde Council and NHS Greater Glasgow and Clyde under the UK General Data Protection Regulations and Data Protection Act 2018. This meeting will be broadcast and recorded to fulfil our public task obligations to enable members of the public to observe the democratic process. Data collected during this meeting will be retained in accordance with the Council's published policies available through the Council's website. Members of the IJB Audit Committee are reminded that they should follow the IJB's established meeting protocols, including around the use of the chat facility. That comments made in the chat facility are visible to all participants in the meeting, which may include members of the public who have also received invites to the meeting. Okay, thanks, that's the formal bit over. Yeah, just to mention this is my first meeting, so just go nice and lovely. And if any errors, if I miss anything, just give me a nudge, just before we start, I think it's worth mentioning that this is Diane's last IJB Audit Committee. I'm sure you'll be sad that you're leaving when you're off there in retirement. You'll be missing us, wishing you were talking about audit. So just want to wish you luck. I think there's a few words going to be said in the name. Just to
I'm here.
And then, you're going to see whether
I'm sorry. Everything's all right now. I'm
Karen, you need to. What's your meeting? I thought she was going to try and get in very well. So yeah, just to wish from all for the audit committee good luck in that. And happy retirement. Thank you for your service. Thank you. Right. If we start off with apologies, substitutes, and
Chair, we have no apologies for absence. We'll now move to a roll call before asking for declarations of interest. Can the following members please indicate if they're present at the meeting either in person or remotely? Councillor Quinn, present in the chamber. Councillor Reynolds,
present remotely.
Dr. Metcalfe,
Present.
and Karen Turner. Diana McCrone,
Present in the chamber.
Are there any declarations of interest?
okay, so thanks, Diane. Okay, so agenda item 2A, which is the minute of the meeting of the IJB Audit Committee of the 9th of September 2024. Any comments, omissions? Thank you. And 2B, the minute of the special meeting of the IJB Audit Committee of 18th of November 2024. With that, anyone with any comments on that? Thank you. So agenda item 3, the IJB Audit Committee rolling annual work plan. Sorry.
Okay. Thank you, through yourself, Convener. This is our standard audit committee rolling annual work plan that we have. This just highlights the main work that we're going to be doing over the next couple of cycles, next 2 or 3 cycles within the audit committee. But I think it's fairly self-explanatory in the main work that we're doing. I was always happy to take any comments or questions.
Okay, any questions for Craig? Yeah, or okay. Okay, so it says move on to agenda item 4, internal audit progress report from the 1st of June 2024 to the 28th of February.
Thanks, Chair. So this report sets out progress made against the internal audit plan for 24-25. One audit was finalised in relation to budgetary control, which had a strong overall control environment opinion. There was one green issue identified, which had been progressed by officers. The remaining audit on this year's plan relates to the self-assessment exercise for the Audit Committee to carry out against SIPVA's good practice guidance on audit committees. We're looking to use a development session to discuss this with members, which I'm happy to facilitate. and the output from the session would then be reported to the next Audit Committee together with any improvement actions that are identified. In relation to the status of internal audit action plans, there were 3 actions due for completion by the 28th of February. One is complete and a revised date has been set for 2 actions, one of which relates to the finalisation of the review of the integration scheme, and the second one relates to workforce planning actions where there was a link into the Pentana system. Management comments on both actions is included at section 4 of the follow-up report. At paragraphs 3.12 and 3.13, the report provides a high-level summary of reports that were issued to either Inverclyde Council or NHS GG&C, which are relevant to the Integration Joint Board Audit Committee. Happy to take any questions. Thank you, Chair.
Thanks, Andy. Is there any questions for Andy on the draft report? Let's see if we can. That leads us on to agenda 5, which is the status of external audit plans as at 20.
Thank you, Chair. There were no actions due for completion by the 28th of February, and there are 3 current actions being progressed by officers. There were no new actions arising from the 23-24 audit, so these 3 actions relate to prior year actions which are ongoing. Chair, I've used the updated position on these 3 issues that was reported by external audit to the November 2024 Audit Committee, and officers are in attendance today if there are any questions. Thank you, Chair.
Any questions? The external audit report. Not likely today, have we? That's great. Thank you. That leads us on to the agenda item 6, which was the IJB best value statement 24-25. Craig.
Thank you very much for yourself, Convener. This is the yearly review of the IJB best value statement that we do. IJBs have a statutory duty to note arrangement to secure best value. In order to do this, we have updated our best value statement as per the report. The statement considers Inverclyde's position in relation to the 7 key Audit Scotland themes of best value, and this has been considered by the SNT. As part of this process, we presented this position to the IJB for feedback, and we're pleased that we received 6 responses for this. As you can see in the report, all the respondents agreed with our position, and from what we've seen, there's only been minor changes that have been suggested. Obviously, we're pleased to demonstrate our achievements of best value, and as always, happy to take any questions any member of the board might have.
Okay, any questions for Craig? Okay. Great, thanks. I think everyone paid in, so that's probably why there's, yeah, so we're going to keep reading here, so you'll be any questions come up at that. So, great, thank you. We'll move on to agenda item 7, which is the IJB.
Thank you very much to yourself, Convener. Again, what we do as an IJB Audit Committee is we bring forward a position on the risk status within the IJB. As we said, we're pleased to close our updated risk register. Just wanted to highlight a few of the key changes that we've had since the last time it came to the IJB Audit Committee. There have been some narrative changes around risk number 3, around the financial sustainability. And this is to reflect the ongoing challenges we have in our 2 main areas of risk, being the children and families and the prescribing budgets. Work continues to be ongoing around this, and the register has been updated to reflect this. We didn't feel at this point there was a requirement to either increase or reduce the risk, because we know there are plans in place for all of these areas, and later on today we hope to set a balanced budget which will help us towards that overall achievement. Also, in relation to this, around risk 5, around the workforce, this has been reduced to 6, and this is reduced to 9, and it's due to the relevant service updates that happened around that. Risk number 7 around the strategic plan and risk number 8 around national patient safety. We've also had some minor narrative changes. And finally, risk number 9 has also had some minor narrative changes around it, around the availability of RSL housing, but generally not any major significant changes in our overall IJB risk. Happy to take any questions.
That's great. Has anyone got any questions about this?
Yeah, thank you. Thank you for this. I wanted to ask about risk 5 and workforce, and that's probably just a bit of clarity, but I think reading the description of the risk, it's mental health inpatient and medical staffing in particular, if I'm getting that right, but then the potential impact does talk about community wait times as well. And I understand from the narrative the risk being decreased because of the inpatient bed have all been opened. So I suppose it's just in terms of what is the risk? Is the risk about the medical staffing or is it about the open inpatient beds? Is the first question. And then on that, I suppose, are we happy to reduce the risk in terms of medical staffing, given these are locum posts, given the risks of the short-term duration of them, and also, on top of that, mindful of the paper that we're going to be discussing at the next meeting about the wider mental health workforce risks, and there is noted in that a risk of not meeting targets. So I appreciate there seems to be medical staffing, but so that's what I just want a bit of clarity on.
Okay, so Kate, I'm going to pass over to Katrina, who's the expert in the
So the short answer is both.
Okay.
When consultant medical staff are appointed, they're appointed with a proportion of their posts to inpatients and a proportion of their posts to community. So while the biggest risk is around reduced access to inpatient beds, the lack of medical staffing can also lead to longer waits within our community services. In terms of the locum posts, what we have managed to do though is secure longer term locum posts, and in particular in our adult services, the consultant that we have in the locum post has indicated that he will apply for the full-time post once it's re-advertised. So that's why that particular risk has reduced. We're still working through some of the challenges within our older people's mental health. So there remains a reduction in our older people mental health inpatient beds as a result of having no permanent consultant staff, but we have got a specialist grade who's now in post, and we also have a long-term secondment and a long-term locum. So we're just working through the impacts of that, and we continue to advertise those posts on a permanent basis. In terms of the community waits, that's for a variety of different reasons. So the medical staffing is one element of it, but the other element is really just the sheer demand. So there has been a huge increase in demand for mental health services. We're currently going through a development phase where we are looking to implement the new community mental health framework, which is part of the overall mental health strategy. And that will allow us to look at different processes and systems in relation to how we manage the referrals coming through the system and how we create capacity within our community mental health team. So initiatives like patient-initiated follow-up, for instance, will allow us to create some capacity that will allow us to meet some of those targets. Sorry, what was the last?
No, I think that's fine. I think that last bit did cover that bit. I was just thinking about that you mentioned, because I know we're going to discuss it at the next meeting about, and there is risk to the wider mental health workforce reductions. And
yeah, and I think we will come on to talk about that. But the impact, as we've noted in November, to our direct services as a result of the reduction in the mental health outcome framework is minimal. The paper that's coming to the IJB is really about emphasising what we contribute to the system-wide services.
So I suppose in terms of this risk then, it sounds to me like the risk is inability to deliver on the services because of the
reduction, of the reduction in medical staffing in particular.
Okay, thank you. You might just get that. Thank you.
Is anyone else? See any online? I think it's probably worth mentioning. I think Andy mentioned about the development session earlier about the audit. We're planning to maybe do a session as well as that. We've got new members of the this committee as well to kind of look at the risks and attitude to risks and explore that a bit further in a development session where we can ask all our silly questions and hopefully we'll be able to answer all our silly questions. So, so we will in that session as well. Thanks. Okay, that moves on to agenda item 8, with the directions update from February 2025. Just to note, thank you, Vicky, for doing it and take chronological order if that's the right words. In the order for updating that, that's helpful. Pass it to you.
Thank you, Chair. Purpose of this report is to ask the IJB Audit Committee to note the summary of the directions issued by the IJB for the period from September 2024 to February 2025. As usual, paragraph 4 of the report sets out the summary detail and a copy of the directions log is attached to appendix 1. Stated at paragraph 3.3, this report provides only a summary of directions issued rather than on the content. As agreed at previous audit committee, completed and superseded directions from previous financial years have been removed from the log. As a reminder, the IJB Audit Committee's remit in respect of directions is to maintain an overview of progress with their implementation and to escalate any key delivery issues to the IJB. I'm happy to take any questions.
Okay, any questions? Okay. No. Okay. So that says on to agenda item 9, which is external audit or 24.5. If you want that to be used, it will actually need to be.
I wish, unfortunately. Thank you very much there, Self-Convener. This is the report, it's highlighting the external audit fee, proposed audit fee 24-25. I just want to make one change, if that's okay, just make everyone aware of it. At section 1.2, it should read, the purpose of this report is to present to PMG as opposed to Audit Scotland. So I just wanted to highlight a typo there. But the main part of the report is just highlighting that the proposed audit fee was £34,000. This is a 1.9% increase from last year's fee. I've highlighted in the paper just the kind of trend we've had for a few years about how much it's been, and just asked for the Audit Committee to approve the proposed fee.
Okay, thanks. I assume we don't have a. So anyone get any questions? And we agree with the report. Thank you. So that moves us on to item 10, which is joint inspection of public services. Thank you.
Thank you very much, Chair, to be you. The report within the pack is the latest update on work to implement the improvement plan, which followed the joint inspection that took place in Inverclyde last year. That was a joint inspection with the Care Inspectorate and Healthcare Improvement Scotland, and focused on adult services integration and outcomes, with a particular focus for people living with mental illness and their carers. As it was a strategic inspection, it was structured around looking at how effectively the partnership works together, strategically and operationally, to deliver seamless services that achieve good health and wellbeing outcomes for adults. The improvement plan that we've been working to is attached as an appendix and demonstrates a number of themes of the plan that have been taken forward since then, and these are particularly focused around the development of outcome measures, which are informed by the users of services and their carers. Also, a real focus on how the needs of unpaid carers are identified and met, and considering effective arrangements for teams working in a more integrated way, including co-location for those opportunities are available to deliver seamless services. Focus on the workforce is reflected in staff confidence around their ability to work with and promote self-directed support to maximise choice and control for people and carers. And there were also actions related to strengthening our social work governance arrangements, particularly for the statutory functions of mental health officers. Members will see that the majority of actions have either been completed or are on target to be completed within timescales. And more detailed audit activity and improved methods to capture quantitative and qualitative data have been progressed, and work to report activity to the Care Strategy Board is being taken forward by the Service Manager for Social Work. That post was developed in line with the inspection findings that I've already referred to.
Okay, great, thank you. I think it's good to note that all actions are either well on target, that's reassuring. Has anyone got any questions for Jonathan?
Can I ask what training you did to improve the staff's awareness of the self-directed support? Has it made any difference in the uptake of it?
With your agreement, I'll defer to Katrina as the operational head of service. Thank you.
So far what we've done is the service manager has held a number of sessions just as part of the routine team meetings to raise the profile of self-directed support, but we are in discussion for a wider event across mental health services and across our social work services around not only self-directed support but the use of assisted technology, and that's really just about building the confidence in our staff. It's not that they don't know about self-directed support, it's really just to give them the confidence to be able to have some of those challenging conversations or potentially challenging conversations. So that's in the process.
Yeah, and just to kind of strengthen what Katrina's saying, we're working alongside Emma Miller, and Emma is a researcher professor at Glasgow University and developed talking points, the original talking points frameworks, which is aligned to outcome focused planning, but is strengthened through the use of self-directed supports, because obviously to achieve outcome focused planning, you really do need to align budgets through self-directed, particularly option 1 budgets that give people the flexibility to purchase the activities or the support that it requires to meet the outcomes, and that is ongoing, and it's been received very, very well. Joyce Allen is leading on that work with it, but just Katrina's right, we're not just rolling it out for adult social work, it's getting rolled out across the HSEP with revised guidance to hope that meets your question, Diane.
That's it. Diane, is that okay?
Yeah, has it made any difference to the uptake of it yet?
Well, we'd have to look at that. I mean, what we have done is that because part of the savings, we've actually looked at self-directed supports as a way of kind of looking at how we deliver savings in different ways, particularly the use of. So we will probably see that the hours will, the amount of people through time will increase, but the reliance on the money should decrease because usually it aligns to outcomes. So that is actually monitored, and it's part of the local government benchmarking framework, and actually Inverclyde are one of the stronger local authorities for the use of self-directed supports, if you want to refer to that.
Yeah, I think we ought to just sort of remember that even if people continue to choose for us to arrange their care, what we're trying to achieve here is the conversation and recording the conversation. So it might be that you don't see a massive change in terms of how people choose to receive their care, but what we want to document and make sure that happens is that discussion around their choices and their options under SCS. So that might be what we need to look at and measure in terms of how we document that conversation and discussion has taken place. But as Kate said, you know, obviously the outcomes in relation to how a person chooses and how the options from a variety of the SCS options, how they choose for their care to be delivered will be measured in terms of outcomes, but we need to measure the fact that the conversations are taking place too.
Thank you. Okay, so I think that's us. Over to everything. That's pretty. Well done, Chair. So, thank you for your attendance and the half an hour tea break would be probably great too. So thanks everyone for your time this afternoon and being gentle with me. Survived. Thank you. Thank you.